Behind these eyes is a story of survival. 19-year-old Mary Hendrix was diagnosed with severe autism when she was just a baby.
She had a little bit of language and then she lost it. She had a little bit of eye contact and then she lost it.
And that was just the beginning.
She was having these developmental issues, but she was also sick.
Digestive problems, skin infections like here on Mary's lips, the list goes on and on.
If she was awake, she was moaning and crying out in pain, biting herself, chewing on herself, banging herself on the head.
It just doesn't seem like that's part of the autism.
But the Hendrix did the best that they could, taking Mary to doctor after doctor, a Band-Aid for each symptom at best.
After 17 years of it, you get frustrated.
You went for 17 years.
Not knowing.
Not knowing.
Not knowing anything.
Exhausted, frustrated, and seemingly out of options.
It just tears your whole life apart.
A specialist questioned Tina about her own health history, and that flipped the light switch.
He said, the key to diagnosing Mary is you.
For years, even before Mary was born, Tina battled colitis, fibromyalgia, and just couldn't seem to kick what she says seemed like the flu. A specialist ordered a blood test for Lyme disease.
I was a bona fide positive.
Because of 2 tick bites that Tina had years before her pregnancy. So how in the world does Mary and her autism play into this?
If the child has autism from birth, many times it's because they actually inherited, if you will, an infection from their mother.
Dr. Lynn Milkey thinks that's exactly what happened to Mary. She calls it Lyme-induced autism. Days after Tina's positive, Mary tested positive for Lyme. That's when Dr. Milkey staged a full assault on Mary's Lyme symptoms.
As we treat Mary for her Lyme, some of her so-called checklist autism symptoms are disappearing.
To hear her wake up and smile and giggle and laugh, we haven't heard that in years.
Getting her there, though, meant making sense of this. Everything that you see on this table, Mary needs daily.
Her cost is averaging $2,500 a month.
Insurance, Tina told me, covers maybe 2%, and the 24/7 care doesn't stop there.
For lack of a better title, we call it Mary's Daily Operating Manual.
Chewing food well, pausing between bites.
Yes, that's a good
These are
thing.
milestones for you.
They are milestones.
For the Hendrix, more like small miracles.
I've had patients in my practice who, with autism, when we treated their underlying Lyme disease, their autism improved to the point that they were no longer autistic.
That Lyme disease is solely responsible for Mary's autism, not something Dr. Milkey can prove, but she says Lyme is an infection that can attack the brain.
I do think especially congenital Lyme is a cause of autism.
Milkey says Mary's autism is so far advanced that her improvement may be limited, but caught earlier, Mary's story could have been much different.
Okay, so we've made this journey, so why should somebody else's child suffer just from not having the information?
And for that reason, I'd like to extend a huge thank you to the Hendrix family for sharing their story with me. I know that wasn't easy, but getting the word out just might help, as you just heard Tina say, somebody else. Dr. Milkey says that Lyme is just one disease that can attack the brain and in turn can be a causal factor in autism. She also says that Lyme is becoming an epidemic. About 20% of her autism patients also are testing positive for Lyme. Let me know what you think about